All right, good morning and happy Wednesday, everybody. Thank you for joining us today for this very special higher level high notes. Today we have an AI workshop for a practical roadmap to AI powered operational wins. I'm Summer Vanderbilt. I am the recruitment development manager here at Higher Level, and I'm so excited to be joined by Tom Harness and Dr. Mark Cordy. So, Tom Harness is an experienced entrepreneur, educator, and U.S. Army signal veteran. He owns Harness Digital Marketing here in Southern Illinois, where he helps businesses improve their online presence using innovative strategies. He has a background in elementary education and educational administration from Southern Illinois University. He's taught marketing at SIU's College of Business and Analytics. And he's also actively involved in community service throughout Southern Illinois. Dr. Mark Cordy, he is a family medicine physician at SIH Logan Primary Care, and he has 23 years of experience. As a Southern Illinois native, he serves in all sorts of different areas. He's a medical director of Logan Primary Care and the medical director of SIH walk-in clinics. Earned his medical degree from the University of Illinois College of Medicine in Rockford and is an associate professor at both SIU School of Medicine and the U of I College of Medicine. So both of them here to bring their expertise in AI. Of course, two different worlds coming together through AI. So very excited to see what they are bringing us today. And we are going to kick it off with Tom focusing on AI in the workplace.
Good morning. Thanks for having us. And so we're going to change it up a little bit. We had another person on here, Cohen, who was really going to cover a little bit more of the marketing aspect. And since my background is in education and marketing, I'm going to try to cover some of that. And then the everyday stuff, we're also going to bring in Dr. Corday for that as well, because he's been using it very, very fast and furious in the healthcare industry, which many of you can transfer that over as well. So just kind of wanted to share a little bit about my point of view of where I'm coming from today in this conversation, and that's AI from an education and a training standpoint. I hope today, as we go through this and we talk a little bit about the questions that we have kind of pre-done here, that you're able to get curious and you continue to be curious about how it's going to work in your workplace. What I hope we don't do is create fear and hands off and let's get rid of it. This is something that we're all going to have to deal with employees in healthcare, in marketing, and all the everything HR. And so hopefully we can do that. And that's kind of where my point of is coming in. And that way, when we go through these questions, we'll have that. And then I'll let Dr. Corday talk a little bit about his point of reference and where he's going to be coming at today with this as well.
All right, Tom. So, as we've said, AI, it's not just for hospitals, not just for tech companies. In the workforce, it's how we hire, it's how we train, develop teams in every industry. We see it in manufacturing, it's happening in logistics. I'm seeing it in HR. I have a lot of questions, though. I don't feel like they're being answered, but how can we fully use this to our advantage and kind of for businesses that are just starting out, where should they begin?
So, from a training standpoint, you need to start having some sort of training or actually looking at degrees that are coming in with experience in AI. Every industry will want to have something, whether it's automation, whether it's human resources, even if it's marketing. Every aspect of it isn't automation. It's not necessarily big machines and engineering. It's everyday workplace stuff. And so when we talk about that, you need to have training. And so, what does it mean to get trained on AI? Well, everything for AI so far in this early stages is built around what we call a prompt. And a prompt is a command. Think of it as how we actually communicate to our team, right? When we tell someone to do something, we expect them to do it. I always like to use the analogy, those of you that have kids, when we ask a kid, especially a teenager, hey, can you take the trash out or take the trash out, especially if we use that word can, right? They're interpreting different. We're saying take the trash out now, right? But they are interpreting it as, okay, I'll get to it, right? And so as we communicate that in our everyday employee interactions, or even family for that matter, we need to make sure that we transfer a better prompt writing, more specific guidelines and how we do that. So some people say, and they get confused, they talk about how, well, I can just do it. If I type it, I can do it. Yes and no. You can get more information when you utilize what you know and the experience you have, whether it's education, whether it's a doctor, whether years of experience. You can transfer that in and allow it to organize it in a way that you can put in and come out with outcomes like HR policies. You can have it come out with marketing materials. And the biggest thing is that I'm hearing is that, well, I put in a prompt, I tell it what I want, and it's crap, or it's not good, or this is basic. And I tell them that's a direct reflection of you, not of AI, that's of you. And so how we communicate into the prompt, how we write those prompts determines that. And so this will be my only plug unless I plug at the end. So what I did was, being an education background, I wanted to come up with a model to be able to teach, train how to write prompts in a higher cognitive level, meaning how we learn to learn. So if we teach our employees, if we teach you, if we teach HR individual people how to write those prompts at a higher cognitive level, we get better outputs, right? And the higher we do that, why is that important? It's important because then we let AI teach us and train us to become better thinkers instead of what? Relying on them and becoming dumber, right? And so there's this whole format called Bloom's taxonomy, and it's how we learn. And it's evaluation is the highest level, synthesis, application, comprehension, and knowledge. And so that is kind of how we adapt. We're down here at knowledge and comprehension. That's basically how we teach. Here's a test, true, false, fill in the blank, but we're not really knowing how to use those concepts. So as we go up to evaluation, synthesis, and analysis, we're really learning how to use that. That's the areas that we want to be writing our prompts in. And that's the areas that we'll be getting the better outputs. It doesn't matter if it's healthcare. It doesn't matter if it's HR or employee relations, emails, marketing. That's where you want to be. So yeah, shameless plug right here. I just wrote it, Prompt Intelligence. I'll put it in the link, but easy book, easy read. It's for entrepreneurs, it's for educators, it's for anybody, but it teaches you how to basically write prompts at that level. And once you train your brain or your team, you get better outputs. You get better outputs. What do you get? You get better and quicker things that you need, right? And so that's the goal of that. And I'm hoping that people will start looking from a training standpoint, that we got to start coming up with the materials that you need. My book is just one of lots, right? I based it off of some 1976, hardcore, when they did some really good testing back in the day, research. And Bloom's taxonomy has been updated a little bit to today, but it's still a wonderful, wonderful resource to have. So, like I said, I'll put that in the links if I can. You can go to Amazon and just type in Prompt Intelligence, Tom Harness, and you can find it as well. But there are some training materials, and there's some other things to go with that. Long answer, but I'm all in on how we write the prompt.
I want to add to that, Tom. When we last did this, you talked about prompts, and it is so key. I took what you said last time we had this discussion, last time we did this event, and I've actually used it in my office. I had a patient that was concerned about a specific medication. So I pulled up an AI-driven, evidence-based medical website that we use. We're very particular. We don't use ChatGPT. There's something called Open Evidence and Up to Date. I pay a lot of money for subscriptions to those annually, and they were concerned about a medication. So I typed in a prompt and I tried to keep it generic. Is penicillin bad? All sorts of information came up. Yes, many people have reactions. People have died from allergic reactions. It can cause severe rashes, etc. I closed that and I typed, is penicillin good? Yes, it has saved more lives than any other single medication known to mankind. It has eliminated diseases that were incurable in the past. Simple prompt changes make a huge, huge difference.
Yeah. And to Dr. Corday's ability too, Everyone in here has experience, years of experience, whatever it is, right? So start utilizing that, whether it's your degree, whether it's your background in medicine. So to be able to be more specific in those prompt writings, even for penicillin, right? Of understanding the patient. So you still get to understand the patient. You get to look at the records and really start to see. So I think the other question is, can AI make us dumber? Absolutely. If your organization allows that to happen, right? And you don't want that. This is an opportunity to help create, train. It's a whole new training program that I think that all businesses and organizations can implement.
So, Tom, whenever we're writing these prompts, give us some pointers. What are things that need to be included for somebody that's like myself? I keep putting in prompts and I don't like my results. You said it, it's a direct reflection of what you're putting in. So, what do I need to really use to guide my prompts for AI to provide me with the information or guidance that I'm looking for?
So first and foremost, it's not a basic. You could reverse engineer. You know the outcome that you want, or let's say you don't know, right? You are only limited by the capacity of what you know, and you're hoping that AI will give you more, right? So you have to give it as much information. So, for example, those of you, I'll just use marketing because I just did this the other day. Someone will say, "Hey, I'm not sure my website is good. I'm not sure my website's SEO is good," right? So, well, first off, how do you know if SEO is good or bad? You got to research, you got to know, so have some context, right? You still have to learn. And so I've developed over the periods of time areas of research and stuff that I like and methods that I like that I've trained my AI module to be able to pull in. So that way, when I put a website in, it knows exactly what I'm looking for. The other great part about having AI and prompts is that it does learn, right? And we're going to keep this pretty basic today, but you can create models that are based around all the information. It can be self-contained. And once you have that, you don't have to repeat yourself. I'm going to tell you, I know for a fact, everybody in here that has teams, the number one thing they hate to do is what? Repeat themselves, right? Well, you don't have to do that with AI in the context it knows. So I put research material in that I want it to draw from. I try to be as specific as I want. I know my target audience, meaning you have to know who it's for, the outcome of that. And you also need to kind of know the location of everything from a marketing standpoint. So if it's medical, if it's HR, what do you guys deal with the most? HR is compliance, right? And the problem with compliance is, especially in the state of Illinois, hopefully this doesn't get flagged, is it changes. We have a lot of new stuff. How do you keep up with everything? Well, fortunately, they have thousands and thousands and thousands of documents online that you can access, whether it's a PDF or whether it's an actual website for updates. You literally can pull that in and say, here's all the resources we have for HI that we have compliance. We need to be compliant for these areas. Specifically, look at interest in paragraph here or subsection here. I do that with Illinois State Code. Anytime that I want to look at something veteran related, or I need to look at something for business, can I do this, right? I can pull up the Illinois State Code and have that as a reference. The other thing is, Summer, is don't trust what your first output is. Make sure that you tell it to cite every information, right? If you're doing something, tell it to cite the information where you're getting it from and look at it. People think that this makes it harder and longer. No, it makes you more efficient in the aspect of you're not having to get a book out. You're not having to search the internet. You're not having to write. You're able to say, okay, here's all the resources. Now let's verify. So let's go look at this HR component because this doesn't seem right, right? Or it is right. Let's verify it. I click on the link and I find out, no, that is absolutely not correct. I will say, as much as we love AI and as accurate it is as far as spelling and grammar and formatting, it is not perfect. It's still out of a 99.9%, you got that 90, you got that 0.01 that you have to worry about. And so you still need to be, for compliance, double check, reassure everything that you have.
Tom, I love what you just said, because with all of our HR partners and everyone we've spoke to, one of the largest things, especially in Illinois, is how do we know that what we're getting is compliant in terms of HR? And never once have I heard anyone say, well, you have to feed it the material so that it knows that it's compliant. everybody's always like, well, is it pulling from the internet? Does it know? Because Illinois Department of Labor has this information out there. Why isn't AI following that? It's so simple. That's something that hasn't even like been discussed in any of the conversations I've been in. Feed it the compliance materials. Like
Cite the source, have it
light
pull in
bulb
so you
just
can,
went off there.
yeah, cite the source and make sure that you have that. Again, I'm going to reinforce this throughout this. AI can be an amazing tool to learn and grow and be a better thinker if we allow it. But the problem is it starts in the workplace. You don't want to develop bad work habits and bad culture in your environment, right? You can't do, you have to do the same thing with AI. Not cut it off because people are going to use it and they're going to use it dumb, right? Have a policy, put something in place, encourage it. For as a teacher, I make them cite their prompt. They have to cite the prompt. I'm not as worried about the output as much as cite the prompt. Let me know how you're thinking. Because if we teach them how to think, they're going to grow and they're going to be great leaders. They're going to be great people in your organizations if we show them how to think, right? And this is the beauty of it, is that you can say, show me your prompt, and they're going to be like, no, I didn't use a prompt. And you're like, yeah, I can clearly tell you used a prompt. Show me your prompt, and be like, okay, this prompt is good, but you could have done some things here. I just see a whole different future and vision of this. And this is one component of AI. There's going to be a lot of other components of AI, but for the everyday workplace, we're going to have to put information in. And I think that's where it starts, is how are we going to train our brains to be smarter?
So, as you're saying, put the information in, I would assume you're meaning for organizations to use an AI feature that is all encompassing, like whether it's Microsoft Copilot or something else where it's limited to their organization.
You
Or,
can. And so every organization, like Dr. Corday, you're going to have these highly regulated ones are going to have developed ones. Even ChatGPT can develop its own enclosed. You can work with them directly to create an enclosed function where it's safe and it's secure. But, Copilot's the same thing. The one thing is the prompt writing, even like that's what I tell in the book too, is that the prompt is the prompt. It can insert in any platform, Perplexity, Gemini, ChatGPT, Copilot, whatever you're using, you still have to write the prompt in to get the information. And so you could enter anything. And my thing is training. Again, I think that's what drove me to write that book, and to hopefully train people to be smarter. Right? I want to help create a better AI workforce through getting them to think.
so, how can companies find training aligned with their specific goals? Because I know if I'm in charge of training here at HireLevel, I'm not the subject matter expert to go and train the rest of my team. So, how, as companies, can we find training out there that's aligned with what they want to do as a company?
Well, I'm not sure if everybody saw this announcement. I didn't even know about it. I was talking to Dr. Corday about it, but SIU is going to be offering an AI bachelor's. And so I'm going to hopefully try to get my book in there to be part of the reading portion of it. But you can start there, start looking at transcripts when you're hiring people, ask them what kind of AI background they had. And it's okay if they didn't. Internally, develop an AI team. Even in the book, right? And I'm sorry, I'm not trying to plug the book, but it's just you can develop training materials internally, right? I did that with I did it for educators, so we can get into the school systems and start teaching them to prompt. You can do it with entrepreneurs to learn. Like, you can develop the curriculum. And to your point, Summer, you're an expert up to a certain amount of years of experience doesn't mean that you can't develop a training. You can do that through AI to develop that training material based on, one, being curious. I tell people you have to be curious about AI, and play to your strengths. Know what you do really well, Summer, and then say, all right, here's the areas I don't know. So then start using AI to learn about those things, or the areas that you're not efficient in, and say, hey, we need to adjust this. We all have the capacity to create training materials. And so you can do that. There's a lot of people popping up. I've been putting I won't teach it, but I've developed training specifically based off the book, for industries. I develop it and send it out, and they train it. It can be pretty much everything I've done has been like a 5-day course. You can do some sooner ones, but it creates an opportunity to do that. The other thing is I actually created a module in GPT to help you train. So in the book, you can also click on a little QR code. It'll open up ChatGPT to a module I created at GPT, and you put the prompt in, and it'll train you. You don't have to have the book to do that. You can just go on GPT and do a search for me and prompt intelligence, and you can find that GPT, and you can internally start training yourself. Right? Take an initiative to train yourself to get more smart. Wow, that's horrible. To get smarter about prompt writing, and then that's how you go about it. You can develop internal trainings, whether it's IT. I saw Terrence in here. I see a lot of people that I know in here. There's an opportunity to do that and be compliant, right? Where Dr. Corday was talking about how it was hard to get into this because there is some compliance. The other thing is you have to follow compliance. I will never say, you don't. You have to. Patient security, data, all of that. Even if you upload spreadsheets, you got to make sure that it's not individual information, right? You got to be able to do that. These recordings, making sure that people know that it's recorded, you transcribe it, you then allow that to train your whatever output you want from a follow-up meeting, and then you can execute it. You can tell GPT to remind you to do these things for the client. My point is, there's a lot of opportunity if you slow down and see where your needs are. The best thing to do too, Summer, and I would tell this for anybody, where are you weak in your organization, and see where you can put AI in to make it better.
I want to emphasize what Tom said about having a team. At the root of this, at the base of this, is AI is a tool. It still needs humans to be in charge, and that so closely plays into what I do. I personally don't want AI making medical decisions about me. I want a human doing that. Can AI guide them? Can it offer suggestions? Absolutely. The human has to make that call. We have a team. You mentioned a team. Our team is diverse. We've got an attorney on it. We have compliance on it. We have physicians on it. We have our chief informatics officer on it. We really try to pick apart AI. Part of our task is to find errors. Part of our task is to find what's wrong with it. There has to be human oversight.
So, the World Economic Forum predicts 44% of workers will need to reskill in the next 5 years. Now, what should we be asking from job applicants today when it comes to AI skills? What are things that we need to be looking at to know that they, aren't just pulling our leg, that they truly have the skills that are needed, and they're not just using some hot topic terms, so to speak, on their resume to kind of fool us?
I mean, I think I'll go back to the prompt, have them write a prompt and send it to you and look at it. And honestly, you could put that prompt into, you could get it rated. Again, back to the GPT I created, you could put it in there and see where they're at. Is it basic, or are they actually thinking at a higher level, right? I think, how Indeed and everything started coming out with testing. I think you're going to have tests, but yeah, anybody should have a great resume anymore, right? There's no way in the world of AI should there. So that means everybody should have a great resume. If they don't, they're not using AI. So there's a direct indicator whether you want them to or not. They're probably not. So you can look at that as, oh, they're being creative, they're being original. That's great. Or they're not using the resources and tools available to them, right? I would just call people out in interviews about, hey, here's what I need you to do. Write me a prompt and tell me, right? And then assess the prompt, because I don't have the data because I'm not a doctor, but I'm going to tell you, if the higher cognitive level that people are writing prompts, I'm going to make the hypothesis that they are going to be high achievers. They're going to be people that are going to be great communicators, great leaders, and probably stay in the business because they are at a higher level. I have no proof of that. That's just my assumption based on looking at data on higher cognitive people in the workplace. They're gonna do that. So that would be my suggestion. How would you hire, Mark? How would you, as you start looking at that, how are you going to look at that?
Good question. We have struggled to hire anyone lately, so I'm not sure that my answer is great.
I think that is
We,
the
you,
answer, right? There's a
I
need.
think it is. Yeah. Yeah. There is a dire need, especially for us, for our industry.
Yeah, and healthcare is so specific, right? So it's gonna,
Hmm.
and this is the beauty of this too, right? Because you have something new you're implementing, and it's a new technology, and the colleges, universities, training materials. One, it's an opportunity, but you don't know what you don't know. So there's some excitement in that, but there's the possibility of error. So what do? Don't do it, and you wait a couple, 3 or 4 years, and then your hospital's behind the curve,
Hmm.
or there's just a lot of questions. But at the end of the day, it just takes the initiative to, like, we got to start doing some training. So, internal training, or looking for the types of people that you could hire. But I mean, that to me, I think HR and healthcare would be, or sorry, AI and healthcare would be huge industry to be going into, and a need around the United States for sure.
It's growing rapidly.
All
Like,
right, so we do have a question that's come in through the chat, and it kind of goes over some hiring ethics that I was planning on hitting on in a little bit here, but we'll go ahead and jump to it. So they say, I hear more and more HR professionals are using AI to hire people. Is it safe to upload all resumes to AI and ask it to pick out the best person?
I mean, we've been doing it. AI has been around for a while. Indeed is already, you do the test, you do certain things, it's weeding people out. It's a form of AI. It's just more of an if then. So now adding the AI component into it to look for certain things and what you want universally, I don't think so. But to the person, I don't know who asked that question, but is it equal opportunity employment? That's the key, right? Is AI is your, because I'm going to tell you, everything you put in AI from your is biased. There is no way, right? There is zero way, because it's one, when you're putting your prompts in, it is from one lens. Looking at something through one lens is biased. You can ask it to be unbiased. You can ask it to incorporate these other things, which is fine. But at the end of the day, it is, you are putting your prompts in one viewpoint, right? And that's something to take into consideration. The legal part of that is absolutely amazing. I wish we had a lawyer on this panel, because I think right now it's not, but I can tell you, we're gonna have a court case where someone said they didn't get the job and it was AI, and we're gonna have to deal with that, right? The argument on that side is, well, did you use AI to write your resume, or did you use AI to, implement it? So then you get into this. There's going to be a lot of opportunities. I don't think there's any issues right now, but I think you have to use common sense, right? If you're using AI,
Mhm.
get it to pick the top 10. Actually, just do old school, get a committee. Here's what we got. What do you see that I don't see? What do you not, what do you see that I don't? Because everybody's going to want something to be a part of a team. An AI cannot develop the culture of your team, right? Can't. It can base all the studies and the leadership test that you give them to see if they're going to fit. But at the end of the day, you weed out people when they come in. You weed them out. You talk to them, body language, right? All that good stuff. So just bridge the new stuff with what works really well. At the end of the day, you have to interview. You have to follow up with their references. Like, it's nothing new. I think we're just trying to overthink it sometimes a little bit. Those interviews are going to be bigger. I think you definitely need to put some training into better interviews, because people can fake a lot online.
Yeah,
I
Tom, as
agree with you,
somebody
Tom.
who recruits a lot, in reviewing resumes and knowing what's out there and some of the tools that we have, uses AI to an extent in that it will rank different resumes that come in based on the job description. And I can tell you, I don't like their rankings. As a recruiter, I want to interact with somebody. I want to see how they'll talk to me and pick up on some of the skills that I know us as a company or my client is looking for. Because at the end of the day, the human makes the decision. And I don't want to base my hiring decision off of everything AI is telling me this best candidate has. because 9 times out of 10, that's not the candidate I'm going with. But that's just personal preference.
But
I
there's a
do take it into
consistency that you have to
consideration.
have. You
Mm-hmm.
have to have a consistency in the questions that you ask. So develop
Yes.
your own. Use that, but develop your own system. What I do is I create an education. I have a rubric. I use the rubric. When I get a paper, I use audio. I go through it. I'm like, oh, yeah, I like this. You did really well here. You did this. I'd like to see more of this. And then I do is I take the transcript, I upload it and say, grade this on my rubric. And then I go back and look at it. And that's what I get. What I get is my students get more uh, feedback, right? It's quicker for me to just go through and look at it and talk about it, transcribe it, organize it in a way that they can read, and then look at the rubric. You can develop the same system. You get resumes old school, you plug them into a GPT that's secure, that meets your guidelines and needs, and you're like, grade it. So summer, you have your own little rubric, and you start to put it in for what you've developed, and boom, and then you can adapt it. Like, you know what? I think now I kind of want someone that's 6'10" every time. I'm just kidding, but you could adjust that every time and be
Mm-hmm.
like, I think we need to start looking at this. And then that way you're grading every resume on your rubric that you developed, right? But it has to be consistent and it has to be in a way that is legal, compliant, and ethical. You want to give everybody an equal shot, right? That's the important part. And it can sometimes take the bias out. That's why I like rubrics. It doesn't matter. Here's the paper, you put it in. And what I like is irrelevant. Does it touch all these things? Yes, no, yes, yes, no. And then you look at it and you grade it. Then you don't have to really look at it from that standpoint. Because sometimes I think from a hiring standpoint, I think some people don't get hired that should. And I think it's based on nervousness of a interview or how they personally look. It is what it is. But I think we do for sure weed out people that could have the opportunity. And that's where I think AI could come in handy.
Now, there is a court case right now that's active. You talked about hiring and AI involved in that. Court cases coming through. There's one against Workday, and it's not on the interview and hiring process, but candidates that were getting denied almost automatically, and they were saying age discrimination because they were over 40. They think that the Workday applicant tracking system was automatically declining them. So interesting to see that some of those are coming to light and how that'll play out.
But see, that's not fair either, because without AI, I remember, maybe Mark does too back in the day. If you did your resume or you filled out your application in blue and it wasn't black, they threw it out. We HR people are horrible for the fact that they've always had these little things to weed out, so they don't have this stack they have to go through, right? So it's no different. They were doing their human AI version of. I'm traumatized by this. I didn't use a black pen and I did it in blue, and that's why I didn't get move on to the next stage, right? And it's you. Those of you on here, I'm sure some of you know this for a fact. It happened and it happens. There's all these things to help weed out to get to that thing, to get to the person so you can start narrowing it down. AI is not doing anything different than what humans have done in HR to make their jobs easier. It's just now it's a more efficient, in my opinion. And I'm not calling you out, Summer. I'm just saying in general.
It's just they've got better record of it now. They can blame it on a system and not a person.
Boom.
All right, we've got another question here. Do you find AI generated communication to be more effective in persuading emotional or logical thinkers? I find AI created dialogue to lack humanistic quality. What's your opinion?
I'm gonna let Mark answer that first because I know he's been dealing with it as a doctor. So
Mm-hmm.
Absolutely. It lacks empathy. It is cold. It is clinical. It is simply stating a fact. That's one of the things that we have explored in healthcare. Uh, AI is growing rapidly in our profession, and we're using it as a note scribe. It's been amazing for that, where it can actually type a note for us while we're seeing a patient. Huge time saver, very accurate. We're showing accuracy there of 90, 95%. As we've explored it, to answer some simple patient messages, it is not the same. And I know how I answer patient messages. I've actually been in practice now 25 years. So I think last time I updated my information with Aaron was a year and a half ago. I know my patients, and I like to throw in little personal things. I might answer their message they send through my chart by saying, yeah, sounds like the blood pressure medication's working great. Let's keep it the same. Heard you got a new puppy. What's the puppy's name? AI doesn't do that. I I would like to say it never will. That's probably not true. It will eventually figure that out too. But what I see from it, cold, clinical, factual. Sometimes that's okay. Um, I don't like it. If I'm on the receiving end of it, I don't care for that so much.
And on the
All
flip
right.
side of that, let's say you have a hard time communicating, right?
Hmm.
And these are real things in the real workforce, right? People that look mean. I'm using this example. People that get accused of RBF, right? Not approachable, never smiling, everything like that. And then that translates into how they write. Utilizing AI to help them soften, to help to communicate. Honestly, I've know people that use it to help soften how they communicate because they are exactly the opposite. They are that cold hard, and they can use it to learn how to be a little bit softer for communication, right? We all know the areas that we struggle in. And I think again, look at the areas you struggle in. How can you use AI? Mark is 100% correct. I hope we don't get to a point where someone doesn't want to actually have a voice conversation with their doctor. How scary would
Yeah.
that be? That it's just an AI generated or an AI response, and that becomes the norm, and you truly never know or have that connection with your doctor. The connection with your doctor, especially as you get older, is so important. The trust factor, right? We haven't really talked about that. The trust factor that is developed. Do we want this younger generation growing up in AI to only trust AI? And we've seen it with what the kids don't want to. They want to text only. They don't want to answer phone calls, right? So we're seeing this progression psychologically of what we're doing, and if we're not careful, we're going to lose the communication part of that as well. And I think that will cause HR issues and that to rise because they're not having to use to interact and address people one-on-one in the workplace. They're doing it through text and they're doing it through AI responses. Well, that's not real. The real thing is the reason we need an HR department is because there's conflict, right? When there's conflict and there's disagreements, we have to have that. Not everybody is in this utopian world where we can just get along. And so, you wouldn't have a job if people didn't disagree and there wasn't compliance and you had to make sure people did. It'd be great, wouldn't it? Everybody would just love it. Just people would do what they're supposed to do, but it doesn't happen. I don't do what I'm supposed to do, right? And so I would be an HR nightmare for you, Summer. So it would be I would be pushing the limits all the time, right? AI this or no, let's don't do this, right? And so I think it also gives an opportunity to help people communicate. They can't. I talk about how I think this is going to open up a lot of world. AI will open up a lot of worlds for special needs, specifically autistic kids, young adults, because they can be trained to do prompt work. It's individual. There's a lot of pattern recognition that they're good at. I think that there's a lot of opportunity for special needs in this world because it is kind of one-on-one. And so again, where we lose jobs or what we think we're going to lose, I think we gain in other areas and we gain in other industries as well.
All right, Dr. Cordy, let's kind of jump into what AI looks like in healthcare now. And I feel like we've hit on it quite a bit, like the decisions that you're making about diagnosis and treatment. How do you kind of use that tool in your day to day?
It has grown rapidly. So I read a statistic recently that said in January of 2025, roughly, and these are crude numbers, but roughly less than 1% of clinics in the state of Illinois were using AI. As of January 2026, above 70 to 75% were using it. So the fact is, it is in the healthcare system Like it or not, it is here and it's here to stay and growing rapidly. So far, we're just using it as a scribe. It generates a note from our patient interaction. We've been tracking what that does. I'd mentioned earlier, we're seeing 90 to 95% accuracy. At the end of that visit, it is the human's responsibility to confirm everything in that note is accurate, to sign that note and edit that note. We are careful. We are meticulous about the way we do that. We've also tracked the time that it saves for our physicians. And as time has gone on, regulations, guidelines, et cetera, have created the need for us to document more and more as the years go by. When I started 25 years ago, you could have a brief note that was 5 or 6 sentences and it was good enough. And now 2 pages of a note often isn't enough. As we've tracked that time, it's saving our providers 90 to 120 minutes a day. That's not a week. It is an hour and a half to 2 hours every single day. And we've got some really interesting graphs where all of our physicians are on their computers beginning around 6 or 7 a.m. I say all, I think the number is 98 or 99% of them are on their computer at 7 a.m. all day. At 5 p.m., it drops off to just a few. Our assumption there is everyone goes home, they have dinner, and about 6 p.m., 6:30 p.m., 90, 95% of our doctors are back on their computers until 8, 8:30, 9. This has eliminated that for so many of them. We are upfront and open with our patients. This is not making decisions about your treatment. This isn't telling us what medication to prescribe. It's not telling us what test you need. This is just typing the note for us. I don't want anyone thinking that AI is taking over. I don't want to lose my job. I want to still, be of use to society. And, it's helpful, but it is a tool. It needs human oversight. We have guardrails in place. We have been very meticulous about the guardrails. For my profession, it's different because everyone's concerned about their privacy. You don't want your healthcare information leaked all over the internet. We are very careful about the way AI uses your information while you're in the office. We don't want your information leaked either.
So I'm assuming that information, what goes directly into your medical chart? Like, where does that go? As I told you yesterday, I hit the urgent care with my daughter, and that's the first thing they asked. Are you okay with ambient listening? I'm like, yeah, go right ahead, sign the release. That's fine. And that's great. But what does the doctor do with it from there? Does it just stay in her medical chart, or where does that information really go?
It's amazing. It generates the note within 1 to 2 minutes. So there's not a delay. That was one concern we had initially. Like, are we waiting 12 hours for this to generate a note? And then, well, at that point, do I still remember it correctly? Is the information, what truly happened? So it generates it quickly. And we all have our own workflow. So I'll speak to my workflow. I step out of the room, I hit generate, I pause for a minute, that note pops up. I review that note right then and there. If it is accurate, if it is what I want, I can simply add a few lines. I can change a few things if I want. I sign it, and then that becomes part of the permanent medical record. It is reviewed by the human, always. Because it is analyzing the conversation, it does keep a recording of that. Currently, that recording is held offsite for 30 days. They're actually looking at some ways to shorten that up. The original idea was that they would keep that recording for 30 days, thinking that we as physicians would want to go back, review the transcript, listen to the recording again to confirm the note accuracy. What we're seeing is that we all do that in real time. So these notes are signed by the end of the day. My notes are signed within minutes of leaving that exam room. So that information that time frame will probably shorten up and not be held for 30 days. Uh, Nobody really knew how this was going to work as it started. So they set the 30 minutes really overshooting. Uh, we entered into our AI arena, I think summer of 2024. And it took us about 4 or 5 months to get everything set up to go live. And we went live December of 24. At that time, the data that we had showed that we were the second hospital organization to use AI in the state. I don't know the accuracy of that. It showed Northwestern was first and we were second, which I like to think we were ahead of the curve. We were really trying to do this. Uh, it is a huge physician satisfier, and physician burnout is a growing issue nationwide. We're seeing physician shortages nationwide. If we can keep our doctors happy, then we can keep the good ones here. And this takes away that time in the evening that they were on the computer. It lets them spend time with their family. The physicians that are using it are reporting a more meaningful interaction with the patient. That's huge. Patients like it. We like it. I believe we had all gotten to a point where we basically sat with our face buried in the laptop during the entire patient interaction. Now, you simply click a button, I shove my laptop over to the side, and I look at people. I talk to them. I look you in the eye. What we've found is AI has an amazing ability to leave out side conversations. I'd mentioned it earlier. I know my patients well enough. I'll ask them about things that are happening in their family. I'll ask the grandmas about their grandchildren. It leaves that out. It knows that that doesn't need to be part of the medical record. It leaves out how's the puppy, and it knows that doesn't need to be in the record. It has an amazing ability to leave out profanity. I've got some wonderful and amazing old farmers that I see, and I love these old guys. They're not coming in unless they're sick, but there's a few of them where their speech can be quite colorful. It cleans it up. It types a beautiful note, and it's really quite impressive as to what it does.
That was actually my next question is how personal does the AI really get on these notes, or can it figure out, this is just regular communication. This isn't anything that's needed medically. So you kind of beat me to that punch there. But has it ever picked up on anything when you went back and looked at the notes that maybe you didn't think about in that conversation with a patient?
Absolutely. I'll jump back to what you were going to ask, but didn't because I'd already touched on it. The note itself, we don't really have as much concern about it being personal because it is a document. It is simply documenting what occurred during that visit. The note itself, and this sounds strange because patients can see those notes and have full access to them, but the notes we type are for ourselves. That is a reference for me to go back and look and see what happened with that patient. The medical notes are not designed for you as a patient. Uh, Patients question them a lot of times. They do have some questions as to why it's written a certain way, but that is meant to be a bit more cold and clinical documenting for us versus answering a question to a patient. So I would say the notes it generates are not exactly personal, but we don't want them to be. We want it to state the facts. In terms of it capturing things that we might not have noticed, absolutely. And that has led to what we believe is more thorough and accurate documentation. Because sometimes we're going through a visit and we've been talking about your blood pressure, and my mind is still focused on that. And I'm thinking about what medication I might prescribe. And the patient throws in, oh, by the way, I've been having some ankle issues. If my brain is still on blood pressure, I might miss that. This is great to capture that. There have been times certainly where a patient has said, I can't think of a good example. Oh, I twisted my pinky toe last week. And do you think it's okay? and I take a quick glance. Oh yeah, it's bruised, but it's your pinky toe. Not much you can do. It documents that. I might not have documented that myself because it was just a passing question. This provides more thorough, accurate documentation. And then as we get into the coding and billing world, that actually allows us to bill or code more accurately because it was something discussed in the room. And that actually does count as far as the medical code that we assign.
Hey, Mark, I have a question that just kind of popped in my head about that too. So, does that also hold the doctor accountable too?
It does, which is a good thing. If we discussed it in the room, then we should document what we discussed. And if you look at a human trying to remember that, and let's go back to this, all of us are back on our laptops at 6 or 6:30 p.m. Did we discuss that pinky toe at 8 a.m.? They said their knee hurt at 9 a.m. Was it the right knee or their left knee? This documents that for you. So if you are one of those individuals that likes to sign their notes later, it now has that documented, and it holds you accountable. It gives you accurate information. You then address it. There have been times where I've looked at a note later and thought, oh shoot, I forgot to address the swelling that they mentioned. And I'll call the patient back. Hey, I see that you mentioned some swelling. I'm sorry, I didn't even catch that, but our AI scribe did. Tell me a little bit more about that. Let's address that. So I think it has been a wonderful thing for what we do as far as documentation, thoroughness of documentation, accuracy of documentation.
Do you think
I will.
doctors will have the option to do it or not? Because I'm thinking of malpractice of like they could just pull up
Mhm.
records and stuff to be like, well, you clearly knew because we talked about it. Like you knew this, right? Like I think that would make me nervous. I'm not a doctor, but that would make me a little like that intense accountability of like having to know everything and being like, well, it says right here, we talked about it. Do you think that'll be some of your legal stuff that you guys will have to start dealing with in the future as well?
Absolutely.
Yeah.
We have not made it mandatory. We as an organization have left it up to the physician. If you don't want to use it, you don't have to use it. We've had quite a few that have opted not to use it, and that's okay.
Do they
There
give
is no
reasons why?
pressure.
I'm just curious.
A few of them are older physicians who have said, no, that's not going to work for me. It doesn't do what I want it to do. Uh, I don't get that myself because I've suddenly become one of those older physicians and I find it amazingly helpful. A few of them have been specialists where they feel like it doesn't really fit their clinic flow and what they do. So a couple of our neurologists don't really feel like it captures what they want it to capture in the room. I get that. A few of them have just said, no, I'm skeptical. I don't trust it. I don't think it's going to document what I want to document. I've not heard anyone specifically say what you said, where they're afraid of the malpractice concerns. It's real though. Absolutely. If it's documented, then it occurred. And we are held accountable for that. So that comes back to this being a tool. And it is my job at the end of that note to confirm everything there is accurate. It's the way I want it to be. Did I address it? And I'm not going to click sign that note before I am absolutely certain the information there is the way I need it to be. And part of that is, I guess, my meticulous nature. I don't want to get sued. I don't want to be involved in a malpractice case. I want to make sure the information I have is the best that I can have it. I'll
So,
jump forward just a bit. We have started looking at some other ways to use AI. We've gently entered the arena of it responding to some patient messages. Uh, we talked about that earlier, where it still seems a little cold and clinical. It can be useful. So I had one recently where the patient said, hey, I've got some allergies. Can I take this specific cold medication with the blood pressure medication you gave me? It was a cold medication I was not familiar with. It wasn't one of the basic, hey, this is Robitussin. Uh, and there's 14 bazillion different cough, cold, allergy medications out there if you go buy it off the shelf. It actually generated a response that I found impressive. And I'm going to make this up. It's like, no, you should not use that with your current blood pressure medication because it can cause this type of interaction when taken with your lisinopril. I'm like, wow, I would have looked that up myself, but it gave me that. So it can be helpful. I added to it. I said, let's not do it because of the interaction mentioned above. So there is use to it, but it's just not as warm and fuzzy as I would like it to be. We can add warm and fuzzy to it. We have started looking at it to benefit us in prior authorizations. Everything needs a prior auth now. And I know that sounds exaggerated, but I'm going to stand by it. We spend a large part of our day answering questions about medications, MRIs, CT scans, biopsies, because insurance companies want everything prior authorized. Oftentimes, those prior auths ask questions such as, have they taken this medication before? Have they tried these 3 medications before? Have they done this before? AI is actually very effective at scanning the chart, finding that information, and giving it to you. And it doesn't just say, yes, they took this medication before. It says, yes, they did take this medication before. It gives you the reference, and it will actually say, the note was, January 5th, 2019, and it tells you where that information was taken from the chart. So it has really sped up some of our prior authorization needs. We're just starting to use that. We've started using a feature where it offers a chart summary for a complex patient or perhaps a patient that had a prolonged hospital stay. It can take hours to filter through that information. It can give you a brief little 1 or 2 paragraph summary of what happened during that hospital stay with references to the document as to where it pulled it from. The big thing that we're looking at that we hope to start doing within the next month or two is something that the AI company calls lookalikes. I call it fancy phone a friend. It's to help sort through that complex patient. And we all want to believe Dr. House is real and Dr. House exists out there somewhere, but I don't think Dr. House truly exists. You have that patient with a truly rare condition, and you have 12 symptoms that just do not make sense, and you have done every test under the sun and sent them to specialists, and nobody can figure it out.
It's lupus.
You know,
It's lupus every
it,
time from Dr.
it,
House.
it
It's
is commonly.
lupus.
This will actually scan billions of visits throughout Epic, and it does it in minutes and tell you, hey, here's 12 other patients that have had these same set of symptoms. They ultimately had these tests done and were diagnosed with these conditions. So I think that can be of great use as we sort through complicated patients and trying to figure out those truly difficult situations. It doesn't
And
make
it
the
look
diagnosis, but it gives you some ideas of what it might be.
so then we could start looking at regional issues as well
Absolutely.
and being able to address those, maybe even for funding for specific things. If it's an increase of diabetes or heart risk, and we can say this,
Mhm.
we've got this number, this percentage of our region. That's actually really fascinating, Mark, that you could like look at the region from that perspective as well and try to address specific areas of health to like fix.
This is a growing part of healthcare, social determinants of health, population health. So much of what Medicare is pushing and what Medicare is telling us is coming over the next 1 to 2 years is how well are you taking care of your patient population? And the Southern Illinois patient population is different than the rest of the state. We know that we have higher rates of lung cancer. We have higher rates of coronary artery disease and strokes. We have higher rates of diabetes than the rest of the state. This can actually screen through our medical records and show us percentages and guide us on some ways to address that. Contacting patients, helping us guide education to those patients, even helping us set up some screening tests to see if we can improve those regional numbers.
So all of this really great information, of course, in the medical industry. My mind's just like moving as I see Tom's is as well. Like, what else can we do with this? So, Dr. Cordy, if you get a patient in there that's hesitant and I don't want this, I don't want you using AI for any of my stuff, don't respond to me with AI messages, like kind of what advice or what do you tell them to kind of put them at ease on the benefits of using this?
First of all, I respect that. And if they tell me they don't want it, then I don't use it. Like there is never a hard pressured sales pitch of we must. I'll usually say, great, respect that. We're not going to use it. I'll usually tell them a little bit as to what we mentioned earlier. We do find that the documentation is more accurate than what a human documents. It is happening real time in the room. It is not me going back at 6 p.m. trying to remember, was that your right knee or was that your left knee? I am overly reassurant in telling them that it is not making medical decisions for you. It is not guiding your treatment. It is simply typing the note. I've had a few patients after I've said those things say, oh, I didn't realize that's what was happening. Of course, I will use it. But any patient hesitancy, it's simply, no, we're not going to use it. I've had patients refuse it one time. I give them my brief little reassuring sales pitch, and then they'll agree to it the next time. But it is not required. Always patient's preference.
Of course, I would love to see in the future information from SIH just out there on how they have made advances in the healthcare industry by implementing this and some of the changes that maybe we're just not aware of as patients, and how just saying yes, use that ambient sound can help progress the medical industry even further. So, really
We
great
should do that.
information. I really think it would be great. So I want to open it up for any more questions that may come in for these guys. I know we've had a few here. Really great information. Anything that we didn't cover that either of you would like to add while we wait to see if any questions come in?
I think one of the questions you had, was there a question?
I think we've hit on most of them, but I haven't seen any come in. But did you have a comment?
I was looking at one of the questions that we had kind of pre-done. And so with so many tools out there, which one should I actually use? Um, I think the best thing to do is utilize your prompt and put it in the same prompt into the different ones, whether it's um, you know, Copilot, ChatGPT, Gemini, Perplexity. There's so many out there. Find out which one that works for your industry. There's some that are very academic driven. I myself, I like ChatGPT. I've gotten the best results, but I've also used other ones as well. I think one of the examples was DeepSeek. Just the other thing that we need to be conscious of too is who owns who owns these companies as well. Some people freak out if it's not American based, and that's fine. But I think you need to do your research about where you're giving your information, where your keystrokes are going, right? And as this grows, the other thing I would say, and I think Mark will agree in the healthcare industry, we have no idea where this is going. Like and it's going at a very fast rate. We remember the curve of internet and computers, right? And how we thought that was pretty fast. And wow, these computers and these phones are, this is its own beast. Like I bet Mark gets updates monthly, weekly. I have no idea on the stuff, right? Security, like there's so much stuff. I think Terrence got off here, but I'm sure he gets all kinds of updates. We used to get updates in the IT world for server equipment, right? And that was pretty consistent, but we're talking about something completely new. So if you are going to utilize AI, it is a part of the culture. It's a part of life. You have to be a continual learner. You can't just, I'm going to use it and I'm done. It's so crazy at how fast it is growing. It's just mind blowing of how much more stuff keeps coming out. When you think you can or can't do something, it does it. And it's insane. It's crazy.
We are set up currently for weekly updates, 11:30 a.m. every Wednesday, and I'm not sure that's enough. It's amazing how drastic things change week to week and the new things that come. We may need to go to twice a week just to keep up. I'll answer one thing too. So Tom had mentioned some of the AI tools out there, and someone had asked, like, what is used? For us, we don't use any of those that Tom mentioned for patient safety reasons. We don't want patient information. We don't want ChatGPT answering your medical questions. We have built-in AI within Epic, which is the arguably the largest and probably the best medical software company in the world. Ambient Abridge, another big one that we use, and then Open Evidence is one that we use, and UpToDate is another one that we use. These are far more safe, patient-oriented, evidence-based medicine driven, and quite frankly, most of these cost a lot of money. These are not free apps that you're going to get.
All right. So my last question for you guys is, what is like your, I don't want to say selling point, but what is something that you have done through AI, ChatGPT? It could be business, it could be personal, that you were like, that is the coolest thing that it's ever done for me.
Well, the coolest thing I've seen is its ability to leave out profanity from a patient. That just amazed me. So it saves physicians time. It is definitely increasing physician satisfaction, which means our physicians are more likely to stay. It's now become a recruiting tool. And we're seeing if we don't offer it, that doctor we're recruiting is more likely to go somewhere else that does offer it. We have had patients tell us, I've had a lot of patients tell me that they really like it because they actually feel like it's old school, where they're talking to their doctor instead of their doctor focused on their laptop entering data feverishly. Now it's more of that old school interaction.
That's great. That is great to hear. What about you, Tom?
I I like, there's a lot of professional stuff I use it for, but personally, I like to really use the different ones and different, having access to different Bible versions. I like to like look at different translations, and I like to look at the Bible in a curious way. And so I'm able to ask questions from context of did this take place? Where did Paul go? I like the opportunity, whether it's the Bible, it's a book, whatever you have. I like the opportunity that you can really dissect and dive into something that can be very complex. And again, going back to that curious nature of asking questions, it is a safe place to ask questions. I mean, we're all human nature. We don't want to ask, certain questions around a certain group of people because we don't want to look stupid or dumb. Well, you don't get that in ChatGPT. If you feed it the context of something historical, whether it's a nonfiction or whatever it might be. And then, or even, like I said, the Bible, I love looking at the Bible. And so looking at translations has been really fun. Looking at what is this in Hebrew? What does this mean? Like just being curious. And that's what I would tell you all is just, it's fun to just be curious because you literally have something. I used to, as a kid, had to go to the library and had to get out the Dewey Decimal System to figure out the cards to go find the book, which was awesome. It was like a scavenger hunt. But now we have this, AI thing where we could just search for something and find it and read it. But now we can literally ask a question in the context of a parameter and start having this interaction, right? Like asking these questions and going down the proverbial rabbit hole of like, on that same note, which would probably drive Dr. Corday crazy is, yeah, when WebMD came out, everybody was a doctor. And so now everybody with this, they can, have more, they think they can diagnose more too. So sometimes going down the rabbit hole is not always the best opportunity.
So when you ask it to cite, if it cites WebMD, you know that your prompt is maybe not what it should be, right?
I would just say maybe read from an actual medical journal that was published by Dr. Mark Cordy. Okay, that one might work. I can trust that.
There we go. All right. Well, thank you guys so much. A lot of great information. I'm sure this is something we will have to do again as the technology continues to advance and there's more to talk about. And in the meantime, I'm going to look forward to SIH providing some information on how we're making medical advances with this listening. We're going to order the book. We're going to work on our prompts. All of this great information, guys. Coming up next month in June for Higher Level High Notes, we're going to stay in the cyber world, but we're going to be talking about cybersecurity threats. So I have dropped the link in the chat if you would like to register. Today's recording will be coming out soon as well with a SHRM credit if you are here for continuing education credits. Feel free to share this recording with your friends. A lot of great information here. And we hope to see you all next time. Have a great day.
Thank you guys. Thanks for having us.
Thank you all.
Bye.